Rheumatic fever mostly affects our young Pacific population, particularly our Samoan, Tongan and Cook Island communities. Here in Auckland, we see a lot of the population affected in South Auckland, including Otara, Mangere, Menuera, Wiri, Glendon. Centrally, Glen Innes. Going out west, we see Grey Lynn, Henderson, Ranui, Massey. So those are the areas that we mostly see rheumatic fever. So rheumatic fever is a disease that can affect your joints, your skin, your brain and your heart. Quite often it's triggered off by someone having a throat infection. Some of you might have heard the term strep throat. This is the bacteria, Streptococcus type A, that actually causes the throat infection, which could lead to rheumatic fever. Strep throat, if left untreated, can lead to rheumatic fever, which could cause lifelong damage to a person's heart and shorten their lifespan. However, strep throat can be treated really easily with antibiotics, and you can see your nurse or your GP to get this treatment and prevent rheumatic fever from occurring in the first place. If the GP or nurse suspects that you have got strep throat, sometimes they may just offer you antibiotics straight away. And this could be either in a simple one injection and you're done and treated, or a 10-day course of antibiotics that you have to complete the full course to be completely treated. Sometimes the nurse or GP may also like to do a swab just to make sure that it is actually strep throat that you have. So if your child has had a sore throat at all and they seem to have recovered and then develop symptoms of fevers, joint pains, funny skin lesions, or doing abnormal movements, this could be a sign that they've actually got rheumatic fever. So you want to contact the doctor straight away. So what we've seen with studies and with families that we've looked after is that if you have one person in the family who's had rheumatic fever, it is quite likely that someone else in the household who also gets a sore throat can get rheumatic fever as well. So it's really important that if a member of your family has rheumatic fever and anybody else or children say they have a sore throat, they must get this checked and treated to prevent them from having rheumatic fever in the future. So what we know, if people have a cold, damp home, it can spread disease more quickly. So if someone comes home with a cough or cold, then everyone else in the household can get it. But if we have a dry, warm home, we know that we can help prevent the spread of infection. So some of the things that you can do at home is like, on a nice sunny day, open your windows. Let that fresh air circulate. If your home has condensation on the windows, wipe that down. Nighttime, close those windows, and to prevent the damp coming in, you can put door stoppers under your doors. Some really simple things to help get your home nice and dry. Also talk to your nurse or GP if you are in a damp, cold home to see if there is some help that can be provided to you from the ministry to help you get that house a lot drier and warmer. Rheumatic fever is a serious disease and can lead to lifelong health problems. Let's protect our children in our Pacific communities. For more information, visit alliancehealth.org.nz.